Today, the Columbus Medical News is at Buckeye Dermatology, and I will be interviewing Dr. Adam Hessel. So, Dr. Adam Hessel, should the people of Central Ohio be concerned about skin cancer?
My answer is absolutely they should be concerned about skin cancer. Skin cancer is very common, and the sooner and earlier that you detect a skin cancer, the more likely it is that you will cure it, the more likely it is that you will be able to remove it with leaving less of a mark or any sort of disfiguring scar. There are three types of more common skin cancers. The basal cell skin cancer is the most common cancer in mankind. This is the type of skin cancer that often does not spread inside and kill people, but it is disfiguring, and the longer it hangs around, the harder it is to remove, the more chance it actually will leave a scar and cause disfigurement. The squamous cell carcinoma is the next most common skin cancer. This is closely related to a precancerous lesion we call actinic keratosis. This is a very common lesion. The actinic keratosis is often red, scaly lesions that people may confuse with dry skin, particularly on the sun-exposed surfaces of the face and the backs of the hands. And these lesions, if allowed to go on for a while, some of them will transform into a more full-blown squamous cell carcinoma. So having any lesion that might appear to be a red scaly lesion, a warty lesion, a pearly lesion, which is more characteristic of the basal cell skin cancer, these are all important to be checked. Now, the most serious of the skin cancers that we more typically see is malignant melanoma. And malignant melanoma can begin in a lesion that may appear to be a brown or tan mole. The moles that we tend not to worry as much about are ones that are round to oval, evenly tan, evenly brown. However, if moles start to have more irregular shapes and sizes, have different shades of color, have notches and asymmetry in the borders and in their general shape and configuration, then we're more concerned about those lesions, and you can have melanomas that look like moles, only be subtly different, and a trained eye from a dermatologist is how you will detect these lesions often. If you have any changing mole, you should see the dermatologist, because that can also be a sign that something is beginning to go bad with a mole. I recommend that anyone who has lesions, moles, spots, have a baseline examination from a dermatologist, get a sense as to whether any of them are suspicious, if any of them are considered not to be normal looking, have the dermatologist biopsy them. You want to detect these lesions early, because that's when they're easier to remove and more likely to be cured.
It's very interesting. Thank you for watching Columbus Medical News.